Good afternoon, everybody. First of all, I'd like to thank you for this opportunity to talk at this important webinar. Now, I introduce myself. I'm Federico Nalesso. I'm a nephrologist at the Department of Medicine of the University of Padua. I'm also the Chief of Intensive Care Nephrology in this unit. And now I'll talk about a standardized protocol for hemodialysis vascular assessment, and I will show you the role of the ultrasound and Doppler in this field. In order to standardize the ultrasound examination, it is necessary to introduce a share protocol by all operators. We have some problem with the ultrasound examination because this exam is operator dependent. We can identify a different point of view between the nephrologist and the vascular surgeons. There is an intra-operator variability, and we can also highlight a problem with the reproducibility between different nephrologists. In order to resolve this problem, we have to first identify vascular access problems, then introduce a standardization in our protocol, so we can formulate a common path for the assessment of the vascular access. Then we can use an algorithm, and we have to test this algorithm in our clinical practice. And finally, we have to improve the proposed global model according to the study of results obtained in the interdisciplinary management of our vascular access. First of all, it is necessary to identify the clinical situation in which it is necessary to perform an ultrasound examination to better manage the resources available. We have to identify some indication according to our clinical practice and our reality. So we can have a protocol for the general follow-up of our customers. We can introduce the ultrasound when we have an hemodynamic problem during extracorporeal circulation. We can also use the ultrasound when we can identify a bleeding problem after the treatment or during the vascular access cannulation. We can also use ultrasound for problems detected during the physical examination provided by the nurse. And finally, we have to use the ultrasound to map the vascular access in case of cannulation problem or cannulation failure. As you can see, in the general protocol, we can divide our vascular access in two categories. The new vascular access can be analyzed according to these times. The vascular access without sign of dysfunction can be assessed every 3 months. As you can see, if we can identify a dysfunction in a new vascular access, we have to request a vascular surgeon consultancy. If we can identify a dysfunction during the hemodialysis in the vascular access without sign of previous dysfunction, we have to repeat the ultrasound and then ask for a surgeon consultancy. As a recommendation, we suggest an ultrasound examination and a physical examination every 2 weeks in the new vascular access, and every 3 months in stable vascular access without sign of dysfunction. If we can identify a vascular access dysfunction, it is mandatory to ask for a vascular surgeon consultancy in order to better identify the problem and proceed with the best clinical practice according to the local guidelines. During the extracorporeal circulation, we can identify some situation in which the blood flow is decreased. We have immediately to check for the arterial and venous pressure, and we have to perform the ultrasound examination if we can identify an alteration in the pressures. But we suggest also to check with the ultrasound the vascular access, also if the pressure are good, because we can identify some problems related to acute complication of the vascular access and also with the needle position. In other cases, we can have a blood flow in the range, but we can identify an alteration in the arterial and venous pressure. In this case, we have to check the value according to the previous value, and then we have to perform the ultrasound overall to identify the needle position and to recannulate the vascular access to reduce the pressure and achieve the best blood flow for the access. According to our protocol, it is important also to consider the number of dysfunctions. If we can have only one episode, we can check the blood flow and the pressure in order to identify some alteration that have to be analyzed by the ultrasound. If we have more than 2 episodes in the same week, we have to perform the ultrasound in order to identify acute complication in the vascular access, or we have to identify some needle malposition. But if we cannot identify alteration, we have to think about new point of cannulation in the vascular access. In case of bleeding after the needle removal, if we have only one episode of the bleeding, we have to check the blood flow and the pressure. If there is no alteration, we have to think about some problem with the anticoagulation of the patient. Otherwise, if we have some alteration, we have to perform the US examination, because we can have a problem in the vascular access that can determine an increase in the pressure and consequently a bleeding. It is also important to introduce the ultrasound when we have more than 2 episodes, because in this case we have to analyze the anticoagulation of the patient and we have to analyze the pressure, because if you have a high pressure in the vascular access, it means that there is a problem in the blood flow, and we have identified the problem as soon as possible. The role of ultrasound is very important also when we can identify some alteration about the trill, or if there is some abnormalities compared to the previous physical examination. And overall, we have to use the ultrasound if we can identify some acute complications, such as the appearance of aneurysm or hematomas. If the vascular access palpation is difficult or the cannulation is difficult, it is recommended to map the vascular access, take a photo, and then perform the cannulation by ultrasound to avoid complications. This is an example of an algorithm that can be introduced in the clinical practice to help nurses and physicians to perform ultrasound in specific condition. The name is vascular access management because this algorithm provides information about the indication of the use of ultrasound. This is important in the ultrasound examination to have an order. So the first examination has to be provided by the brightness mode. The second step is the use of the color. The last level is the use of Doppler. With this paper, we introduce a vascular access study algorithm to standardize the exam and make the vascular access analysis reproducible by different operators. Here are cited other papers that may be useful in the analysis of vascular access. The proposed algorithm provides a step-by-step analysis of the vascular access. It describes for each step the elements suggested to be analyzed.
For every element, we have to discuss about the characteristics that we can find in two orthogonal scan plans, and we have to describe all points to better have a description of the vascular access and share the information in a standard protocol with the other nephrologist and with the other personnel.
As you can read in the paper, the elements that have to be analyzed in B-mode and color Doppler and Doppler spectrometry are described for each structure that you can find in the vascular access.
So it is important for every structure, for every element to have an order and to describe all points in order to share information with nurses, with the vascular surgeon, and with the other nephrologists. This is important also for the cannulation procedure.
The algorithm can also be used before surgery with the aim of studying the patient arteries and veins and predicting any complication in the maturation of vascular access and its cannulation. The step-by-step protocol is the core of the study algorithm, as it requires the systematic study of the all elements in a univocal and sequential way, starting from the B mode and ending with the Doppler analysis. And now we see the images. In this slide, you can see on the right the brachial artery in B mode, and on the left you can see the M mode of the artery in order to identify the maximum diameter. As you can see in these slides, you can identify a Doppler analysis of the brachial artery blood flow. We can see a monophasic wave with low resistance in the downstream of the arteria. That means that the vascular access is working well without dysfunction because the blood flow is good. As you can see, having low resistance flow in the brachial artery means having a patent vascular access with preserved flow. As can be seen from the detail of this Doppler analysis, the flow in the brachial artery is continuous and high, even in diastole. With this pattern of Doppler analysis, we can say that the vascular access is patent. In this other example, we identify a significant reduction in diastolic flow with the appearance of a reverse wave. These elements are indicative of dysfunction of the vascular access. With this Doppler pattern, we have to think about a complication with access dysfunction. As the first element, we have to analyze the arterial anastomosis by studying the structure on two orthogonal planes to better describe the diameter of the anastomosis. As you can see in these slides, we can better identify the brachial artery and the anastomosis in a longitudinal plane. In these slides, we can see the diameter of the anastomosis that can be measured by this scan. In this slide, you can see the graft anastomosis with the vein. And in this longitudinal scan, we can have in the same plane the brachial artery and the first part of the fistula. So we can study the diameter of the anastomosis and the blood flow. As you can see from this slide, we identify the brachial artery with a pulsating color, while the fistula and the first part of the vascular access has a continuous color, indicating a continuous flow in a patent vascular access. Other important elements are the diameter of the vessel and the depth with respect to the skin. These are important elements for the cannulation and to provide indication for the cannulation of difficult vascular access.
Allora, porta pazienza che ti senti un po',
As you can see from this little clip, cannulation occurs by palpating the vascular access. If the procedure is controlled by ultrasound, it shows that the procedure can be burdened by complication. As you can see, the tip of the needle causes a lesion of the anterior wall of the vessel during the procedure. In other cases, the lesion may occur at the level of the posterior wall if the tip of the needle is positioned more deeply. Another interesting application of ultrasound is the possibility of identifying the turbulence caused by the malpositioning of the needle, as seen in this slide. In this slide, the stenosis is identified by the aliasing artifact, which indicates acceleration of the blood flow in a precise point of the vascular access, as you can see in this point. By the use of Doppler, it is possible to quantify the systolic peak velocity and provide a quantitative parameter that can describe the stenosis. As you can see in this slide, the peak systolic velocity can reach the value of 5 meters per second. That is very indicative of stenosis. In this slide, we can see the thrombosis of the vascular access. The image in B mode identifies the thrombosis. The color allows to identify the residual blood flow in the vascular access. The follow-up of this vascular access allows to identify the solution of the thrombosis after 2 weeks of heparin use, as you can see in this part of the slide. In B mode, scanning in 2 orthogonal planes, the longitudinal and transversal plane, allows to correctly identify the diameters of the aneurysm in the vascular access. The color allows to identify the artifact caused by the turbulence in the aneurysm, as you can see in the pictures. In this slide, it is possible to identify a obsidian aneurysm due to the damage of the anterior wall of this graft. And below, you can see the color alteration in the color analysis.
You can see the damage in the anterior wall and in the posterior.
This slide shows the formation of a obsidian aneurysm by the damage of the anterior wall or the graft in this point, as you can see in the slide. The color in the two orthogonal scans highlights the patency of the two structures, graft and the obsidian aneurysm, as you can see in the slide. In this small clip, we can perfectly see how the pseudoaneurysm present blood flow. This image also highlights the presence of obsidian aneurysm due to the damage of the posterior wall, probably from the puncture of the wall. The slide summarizes the scans and correctly describe the size and the position of the obsidian aneurysm. In this slide, we can see a stenosis that we can identify by the aliasing in this point. In the slide, you can see the aliasing due to the acceleration of the blood flow in this point due to the presence of the stenosis. By the use of the Doppler analysis, we can identify and measure the peak systolic velocity and measure this velocity in the point of stenosis. This slide shows the presence of edema in the soft tissues compatible with blood extravasation during cannulation of the vascular access. We suggest to have some picture about the mapping of the arteriovenous fistula cannulation for the clinical practice. As you can see, the vascular mapping is very important and can provide a useful tool to nurses for the cannulation procedure in order to avoid the complication related to the procedure. So the ultrasound and the physical examination together with the continuous follow-up are essential tools to assess the vascular access. If we can introduce a standardized protocol, we can have a very useful tool to assess the vascular access and have the best follow-up for our patients.